Good evening. Welcome to everyone joining us. This is our first RAMI webinar. So I'm not sure whether you're totally new to RAMI or you know a little bit about us, but we're essentially the Regenerative Aesthetic Medicine Institute. So we run the Ramsey Conference and we publish JRAM, so a journal dedicated to regenerative aesthetic medicine. And this is now our first webinar. So we will be running a series of webinars over the next year. We've already got 3 booked in. The first being tonight, all about polynucleotides with Professor Maurizio Cavallini, who's going to join me now. So before we get started, we just want to do a couple of polls just to find out a little bit about you and your level of experience this evening, and then we'll get going with the presentation, which is going to be super exciting. It's going to give you some really good insight into some new research that's being done, techniques, and lots of exciting things in the world of polynucleotides. So if we can get the polls on the screen, and if you can just select your profession, please, doctor, dentist, nurse, pharmacist, or something else. Thank you. There we go, getting lots of answers in. And just so you know, this webinar is being recorded so you can watch it back, or if any of your colleagues have missed this evening, then they can drop us a message and we can send it out to them. Next question now is related to your level of experience using polynucleotides. So that should be popping up on your screen any second. There we go. So first, are you using them? Not used, would like to know more, have only just started, or you're regularly using them now. So let's see all responses on this. Okay, looks like majority are regularly using them now. So this is great. Maurizio is going to give you some updates on latest research that could be really valuable to your practice. And then we've got a couple of people who not use and would like to know more. So great, this is a good place to find out all about them and how they can benefit your patients. And then the next question, have you subscribed to RAMI? So this is the Regenerative Aesthetic Medicine Institute. Are you already a subscriber? Looks like most people are. But if you aren't, not to worry, we can send you a link to register with us. It's free to join. And like I said, you get really easy access, first access to all of our webinars coming up, and you get our journal of Regenerative Aesthetic Medicine, free every quarter, posted out to you, and we've got loads of good content on our website as well, all related to regenerative aesthetics. And then finally, if there are any topics that you're really keen to learn about in regenerative aesthetics, do you mind typing them below? So what future topics would you like to see us talk about during these webinars? And just so you know, we've got our next one coming up 20th of April with Dr. Lee Walker, and that'll be on about complications related to regenerative aesthetics. And then on the 11th of May, we have got Anna Baker talking about therapies to counteract changes that have occurred from GLP-1 treatments. So some really interesting topics we've got coming up, but if there's anything else in particular you'd like to learn about, let us know and we'll find some good speakers and book them in. Thank you so much for the responses. Okay, I'm going to now hand over to Professor Maurizio Cavallini, who, as I'm sure most of you know, is an absolute pro in polynucleotides, and he's going to guide you through tonight's presentation. If you do have any questions, pop them in the Q&A below. It might not be shown on your screen. You might need to expand your screen to see the Q&A box, or press the More button. So the More's got 3 little dots at the bottom. Press that and Q&A should pop up. Any questions throughout, drop them there. And then when Maurizio is finished presenting, we'll run through as many as we can, aiming to wrap up by 8 p.m. Okay, over to you, Maurizio.
So good evening, dear colleagues, and first of all, I would like to thank for this great opportunity. And today is a sad day for me, as you know. I'm a plastic surgeon from Italy. I come from Milano. And today is a sad day because you know that unfortunately yesterday Italy miss the qualification to the World Championship next July, so it's a sad day for us in Italy. However, yeah, you know that polynucleotides, I would like to do an update on polynucleotides because you know that polynucleotides are an emerging injectable in the field of aesthetic medicine. And you know that there is a great interest in the use of polynucleotides. So we know that is a quite new injectables, but I would like to do an update because it is a long history. So my own journey started in the late 19 as I was a resident in plastic surgery in the University of Milano, and we have the need to improve the healing of the donor site of burns. And so I started to use in 1995 for the first time the polydisosylnucleotide and polynucleotides in the donor site of burns. And after this, I had a long experience in the use of wound healing. And so I started to use not only in burns, but also in all the wounds and in all the pressure, vascular sores, and in all the wound healing that in which we need an improvement in the healing of our wounds. But after about 10 years of experience in the use in plastic surgery of polynucleotides, I had a scientific discussion with Mastelli because I believe that we can shift from reconstructive to aesthetic medicine. Because as I'm going to show you, as we have an increasing in the viability and the metabolic activation of the fibroblast, as we saw in wound healing in plastic surgery, I asked to myself why we cannot use as a game changer from reconstructive to aesthetic medicine. And this is why I started to use polynucleotides in aesthetic medicine. And as you can see, my first work, my first paper was as a chairman in a thesis of a student in the School of Aesthetic Medicine in 2006. So it's more than 20 years that I manage the scientific rules and scientific principles on polynucleotides. And as you can see, I started to use and to publish the first paper in the international literature about the use of long-chain polynucleotide gel in skin biorevitalization in 2007. And so you can understand that we are talking about a new emerging injectable, but it comes from a very long scientific history. And to show how is long the history of polynucleotides, I would like to share with you this slide in which you can see that I presented in 2014, so more than 12 years ago in MWC, my first clinical experience in anti-aging treatments with the use of polynucleotides. And then I started to present in many international conferences in 2015, and then again in 2016, in which I presented in NWC the DNA injection from skin rejuvenation and regenerative medicine. So you can see that my experience started in a long time, and then I presented many other papers in many conferences, as in NWC in 2018, in which, and this is important for the next topic, I would like to give you a preview at the end of my presentation, in the use of polynucleotides with microcannulas for biostimulation of the periocular region. So it's a long journey. But, however, first of all, I think that it's important to point out about polynucleotides, and we have to understand what exactly are polynucleotides. And we have to understand that polynucleotides are DNA fraction. So they are polymers made by the condensation of different monomers of nucleotide. So if we have many nucleotides linked between them, we have a polynucleotides. It's very easy. And each nucleotide is composed of three parts. So we have a nitrogenous base, normally with a purine or pyrimidine basis, a pentasugar, that is the deoxyribose, that is able also to give energy to the cells when it's delivered with injection of polynucleotides, and a phosphate group. And the final molecule consists of two antiparallel strands oriented in opposite direction and forming a double helix. But as I told you before, until 4-5 years ago on the market was only present the Mastelli polynucleotides. Now, if you go or if you went to the last MWC last week or in any other conferences, you saw that in the market there are a lot of different polynucleotides. So how we can understand how the HPT polynucleotides from Mastelli different from the others on the market? So first of all, we have to understand the origin of the HPT polynucleotides because they are certified safe trout source polynucleotides. So we have high purification technology polynucleotides that are able to ensure a high quality through a strict quality assurance and veterinary controls. So these type of polynucleotides are extracted from the trout bred in European freshwater farms and ensuring a superior quality through the better control standards. And so all the trouts undergo to a strict veterinary, water, food, and contamination control through the entire life cycles, ensuring safety and purity. And under this point of view, I would like to share with you my experience in the last 20 years in which I didn't register any serious adverse events in the use of HPT polynucleotides, and I didn't manage any serious adverse events in the use of polynucleotides, HPT polynucleotides, also performed by other colleagues. So this is very important because as we know that we are treating our patient, we have to give them the right safety and the right purity of the product that we are going to inject. And so they come from a trout, from the food chain, and so they are controlled and they are breeding in freshwater farms. And from the gonads extraction, we have the HPT technology. And it is an exclusive technology because it is developed in-house and all the DNA purification ensure that the protein content present in the HPT polynucleotides is below the specification set not only by the Italian Ministries of Health, but also by the European controls. And they follow all the good manufacturing practice and they have all the ISO certified that are able to give us the right safety and the right purity. This is why I suppose that we didn't register any serious adverse events because the content of protein is very, very low. And so the purification due to the industrial production offer us the possibility to treat in a very safe way our patient. And for this reason, we know that we have a very fully integrated supply chain. So we know where the trout come from. We know how they are extracted from the gonads of salmon and of trout. We know how they are purified. And we know that finally quality control giving us the opportunity to have a final product. And I would like to remind you that is not present only in Italy or in UK, but Mastelli distribute this product in more than 45 countries worldwide. In addition, I think that when we are talking about an injectable, we must be on scientific evidences. And HPT polynucleotides are supported by a lot of in vitro studies providing a very solid scientific evidence supporting not only the safety, as I told you before, but also the efficacy of polynucleotides in aesthetic medicine. How do they work? So we know that polynucleotides are able to increase the fibroblast viability. And so they are able to promote a stimulating action on existing fibroblasts, increasing their viability. So it means that they are able to push on the metabolic activity of the fibroblast, as you can see in this paper published in 2021. And so they are able to push not only in the production of collagen, but they are able to give a metabolic push on the production of all the substances that are present in the extracellular matrix of our skin. And I believe that is very important because we have very well balanced production of all the components of the dermis. So not only under the quantitative point of view, but also under the qualitative point of view, we have a very good composition of the dermis after the stimulation with HPT polynucleotides. And as you can see in this picture, all the studies that are published could tell us that there is not only an increased fibroblast growth in presence of HPT polynucleotides, but as you can see in the right of the slide, we have a very high production of all the proteins that are present in our dermis. And so this is very important because we have to consider, as I told you before, that we have a balanced production of all the substances that normally are present in our skin. And you can see very well also in this picture, in which in the scratch area, you can see that a visible higher number of bridge are present in the group stimulated with HPT polynucleotides. And I would like to show you also this picture and this slide in which it was an experiment performed on the back of the rats. And so it was done a cut on the back of the rats, and there was 3 different groups of control. The first one without any treatments. In the middle, as you can see, the rats were treated with hyaluronic acid, and in the last on the right, the rats were treated with polynucleotides. And as you can see, in the left group of control, the tissue repair is incomplete with a scarce presence of collagen fibers. But I would like to be focused on the difference that we can note in the group treated with hyaluronic acid and polynucleotides. In both, the tissue repair is not complete, as you can see, because you can see in the upper part that there is a small lack of healing. But I would like to show which is the uniform deposition of the extracellular matrix in the group treated with polynucleotides in comparison with the group treated with hyaluronic acid. What does it mean? It means that if we are able to produce all the substances, as I told you before, we have a very good architecture of the skin of the rats, in this case, of our patient, in the patient that we treat with polynucleotides. This is very important, in my opinion, from my perspective, because it means that we have a very good, well-organized dermis when we inject in our patients. And we know how it's important also to control the presence of free radicals. This is a paper published in 2021 in which you can see that free radicals, there is a decrease in the presence of free radicals in the group treated with polynucleotides or with polynucleotides plus no cross-link hyaluronic acid that is newest. And so finally, we can say that in addition, using the PN HPT, we have also an antioxidant action. And we know how it's important, as a lot of the protein that are present in the dermis are degraded by free radicals that are present. So we have an additional advantage in the use of polynucleotides. And finally, it's important to underline how there is a lot of scientific studies on polynucleotides that are able to support not only the normal treatments, but also the advanced treatments. And more than 90 papers are published in scientific journals from 2006. I was very honored to be an author in many of these papers, as you can see, and there are more than 100 abstracts presented in national or international aesthetic medicine congresses from 2006. And I collect with Mastelli the main papers published in international literature, and you can see that there are a lot of papers published, and in many of them I was involved as an author, above all in the international guidelines in the use of HPT polynucleotides that you can download from PubMed directly, in which we specified all the indications, which is the right product to be used in the different areas, which are the number of sessions that we have to use. So this is only the last 5 years published studies on PN HPT. And you can see that there are more than 35 published studies on PN HPT. So finally, we can say that polynucleotides play a crucial role, not only in improving the skin quality, but also promoting the bioregeneration. This is why we started, and I started to use in wound healing, and I started to use in plastic surgery. And in addition, due to the improved skin quality, we know how they're able to reduce the fine lines, the wrinkles, the skin laxity, and they are able to promote also the fibroblast action, which is the next step and the next update in the use of polynucleotides. In the last 2 years, I propose to use a full-face protocol to redefine the bioregeneration through the HPT polynucleotides. So we know how our patients now want an holistic approach, and they want to have good improvement, good outcomes, but they want to be treated in all the areas of our faces. And so this is why my full face protocol is considered in a holistic way. And I normally have an approach, a specific approach on my patients. And so I want to take care of the 3 different thirds of the face. So in my full face protocol, I normally suggest to treat both the upper third, above all in the perioral area, with a specific concentration of polynucleotides, 50 milligrams of concentration of polynucleotides. But as we want also to correct the skin laxity and the loss of volumization and the fine lines that are present in the middle third, I normally suggest to my patient to undergo to the treatment also in the zygomatic region, so it means in the cheek and in the melee area. In this case, I normally propose the use of Plinest, so a higher concentration of polynucleotides, 40 milligrams of polynucleotides in the middle third, and finally, in the lower third, above all in the perioral area, in all the patients who would like to undergo to treatment to improve the skin, the fine lines, the barcode, the marionette lines, and all the perioral area. In this region, I prefer normally to treat my patients with newest. So is a mix of HPT polynucleotides, 20 milligrams, plus 20 milligrams of non-cross-link hyaluronic acid, as I want to have also a push on the hydration of this area. So normally per session, I normally use one pre-filled syringe of Plinest I in the upper third, one pre-filled syringe of Plinest 40 milligrams in the middle third, and normally one pre-filled syringe in the perioral area with a mix of PN HPT plus non-cross-linked hyaluronic acid. The treatment protocols comes from our international guidelines that I published as first author in 2021. And so I normally suggest to do one session every 3-4 weeks with 3-4 sessions, depending on the age of the patient, the phototype of the patient, the aging of the patients, but the range is between 3 and 4 sessions. So, as I told you before, in the upper third, I normally want to treat my patients with Plinest I. But why I suggest to treat with 15 milligrams of polynucleotides in this area? Because you know that we have different composition of the skin in the different areas. And above all, in the perioral area, we have a thin area with less number of fibroblasts, so we don't need to give us a strong push on the viability of the fibroblasts in this area. This is why I normally want to treat them with this type of product, Plinest I, because I want to use the right concentration of polynucleotides tailored on this area. And this is the video in which I'm showing you how I would like to treat my patients. We can treat both with needle, and so we can treat them with small micro droplets injected with a 30 or 32 gauge needle, covering all the lower, lateral, and upper periocular area. But in my personal experience, I prefer to treat this area with a microcannula. And as I showed you before, I started to present my first results in the use of microcannulas with polynucleotides in 2014. So I have a quite long and strong experience in the use. And as you are seeing, I want to use a small cannula. I normally use a 27 gauge cannula, 38 millimeters or 5 centimeters. And I normally do a small entry point in the zygomatic area. And I would like to show you another time because as you can see, I normally prefer a lateral entry point, because with this entry point I could cover all the area as you can see before. I know that it's quite discussed the use of microcannulas. because you know that with the microcannulas we cannot deliver exactly the product in the dermis because it's quite impossible to inject with the microcannulas in the dermis. But there are some papers, and not only my experience, not published still now, but I'm going to publish in the next future, in which with other type of injectable is show how microcannula is able to give a results also in the improvement of skin texture in the periocular area. From my perspective, this is due to the stretching of the lower part of the dermis. And so in this case, we can have a spreading of the product in the deep dermis when we scratch the lower part of the skin. And these are some results. And as you can see in this picture, the blue, green, violet lines means deeper lines. And you can see that before and after, you can see that we have less fine lines and less wrinkles that are present in this patient. This is another patient in which you can see in a 3D reconstruction how we can improve the finally skin laxity of the periocular area. We can improve the lines that are present in this area. And we can also go with our microcannula or with our microdroplet injection also very close to the orbital rim because, as you know, it's not like a filler. So we cannot create any visibility of the product. We can be safe about the embolization adverse events. And so this is why we can reduce the presence of fine lines and we can improve the final skin texture of this area, as you can see in the disappearance of the blue or the violet lines that are present before the treatment in comparison with the post-treatment. In the middle third, I normally prefer to switch to newest. So I normally use a higher concentration of polynucleotides with 40 milligrams of polynucleotides. And in this case, I normally prefer to do with, small micro droplets, 1 centimeter apart, one from the other. And I normally deliver 0.2 ml, so a very small droplets. And I normally stay very superficial because I'm sure that I can act with all the fibroblasts that are present in the superficial and in the deep dermis. If I don't see any bleeding, it means that I am in a good layer. And so, as you can see in this video, we don't see any red cells or any bleeding, that it means that we are safe, we are in the right layer, and so we are delivering the product in the right way, and so we can have predictable results in the final skin, in improvement of the skin quality. And finally, I believe that in the lower third, it's important to consider that now, as you know, many patients don't want to undergo to filler injection because they are worried about the overfill syndrome. They don't want to increase too much the volume of the lips, and they don't want to see any visibility of the fillers. So in my personal experience, the use of a mix of polynucleotides, 20 milligrams plus 20 milligrams of non-cross-linked hyaluronic acid, as we have in newest, we can give very good outcomes in our patients without having any type of overfill results and giving also a good hydration on this area. So this is a video in which you can see that in this area we can deliver the polynucleotides both with cannula and with needles. I normally prefer, as you can see, the use of needles. I normally use a 32 gauge needle, so very thin deposition of small amount of product. I normally start in the upper lip and I want to inject the upper lip to correct the fine lines that are present in the coat bar. And I normally cover all the area. And as you can see, there is immediately after a good result. I normally do the same in the other side. You know that it's quite painful in this area, but if we deliver very small amount of product, the patient is, we have a very good comfort of the patient, and we can correct all the lines that are present, not only in the white lips, but also in the border between the white and the red lips. So it's very easy and we can cover all the upper area. However, we know how it's important also to correct not only the upper area of the perioral area, but it's important also to correct the fine lines that we have also in the lower and in the chin area. This is why normally after the end of the treatment in the upper lip, I want to treat also the marionette area and the lower. And in the same way, I normally inject a small amount of product, both in vertical or in horizontal direction. And in this way, we can cover all the area, giving a very good results, not only under the push on the improvement in skin quality, but also due to the presence of non-cross-linked hyaluronic acid, we can give them a very good results also in hydration of this area. With one syringe of the mix of 20 milligrams of polynucleotides and 20 milligrams of non-cross-linked hyaluronic acid, we can cover all the area with a very good final outcome and very good final results. Using not a microdroplet injection, but a linear retrograde technique, we don't have any visibility of the small microdroplets. And so there is a very good comfort of the patient also after the treatments. And as you can see, if we stay in the right layer, so in the superficial layer, we are able not to have any type of bleeding, and we have a very good predictable results also in the marionette area and in the chin area. I normally do a small massage at the end, so I would like to mold the product at the end of my treatment, and the final results is visible immediately after the treatment. So, which are the take-home messages regarding the full face approach and about the HPT polynucleotides? First of all, that full face protocol could offer an holistic approach. So we can treat all the area starting from the periocular area, the middle third, and the perioral area. So we can offer to our patients a very good outcomes covering all the different third of the face. And as I told you before, needs are different in anatomical aesthetic units of the face. This is why I normally prefer to use plainest eyes in the periocular area, plainest, so more concentrated, injectable in the middle third, and a mix of less concentrated polynucleotides, 20 milligrams, but plus 20 milligrams of non-cross-linked hyaluronic acid to tailor the treatment based on the different anatomy of the different aesthetic units. So we have to tailor the treatment based on the different anatomy and the different polynucleotide products. And my final goal is to give a natural look and very good improvements in the final outcomes. But today I asked to Chloe and to Simon to share with you also the last trends. And it is an international preview, so I could give you also some details regarding this study and this experience. So it's in a preview of the last studies, and now is submitted this study to the Journal of Clinical Cosmetic and Investigation Dermatology, is under review, is submitted. The first author is my friend Raquel Amado, and with other international colleagues, we had a real-world multinational study of HPT polynucleotides for treating the periorbital hyperpigmentation. Because we know that the eye contour is an extremely delicate area of the face. If I ask you how many times we blink the eyes, maybe you don't know, but exactly. But we normally blink the area for millions and millions times during the year. So it's a very delicate area of the face. And it is continuously subjected to environment stress, so wind, humidity, heat, cold, etc., and natural movements due to the facial expression. And this is why the eye contour tends to age much more rapidly than other skin areas. And the periocular dark circles is a problem. We have a lot of patients asking us some injectables, some treatments, some new ideas, some new protocols to treat the dark circles. But it's quite difficult to give them a predictable treatment, because dark circles are a multifactorial aesthetic concern. And so we know that there is a multifactorial etiology, because we know that we have a pigmentary problem, we have a vascular factors, and there are also structural factors. And the therapeutic gap is that we have not a consensus strategy. It's quite difficult to give and to address only one component of these three different etiology. And above all, the results are often inconsistent. As I'm a plastic surgeon, I know how it's difficult to offer an option to my patient when they come to my private office or to my clinic asking me to correct the dark circles. This is why we started to use, in the last 2 years, Plinestyle for the correction of this area. And so the goal was to collect clinical data on the use of Plinestyle, so 50 milligrams of high purification technology polynucleotides. And we wanted to assess the clinical safety, the clinical performance in the treatment of periocular dark circles, and we wanted also to know if we have a preferred infiltration technique or more predictable results using the needle, the cannula, or both the needle and the cannula. So we had an efficacy assessment. So we wanted to have an investigator evaluation with the guys, so the Global Aesthetic Improvement Scale, assessing the skin firmness, the skin tone, the skin glow, and we also had a guys evaluation performed by the patient, and finally a 5-point Likert scale after the treatment to know which is the evaluation of the patients. So the protocol was performed with 3 injections of Plinestyle, so with 50 milligrams of polynucleotides HPT, at time zero, after 2, 3, 4 weeks, between 2 and 3 weeks, for 3 different sessions. And then we had 2 follow-up visits after 1 month after the last treatment and after 3 months in a follow-up after the last injection. We had also different subject origin because as it was an international study, we had patients from Italy, from UK, from Malaysia, from Turkey, from Indonesia. And we have also different dark circle subtypes. So we had mixed above all, but also only pigmented, only vascular, only structural. And as you can see in the right part of my slide, we used both needle, cannula, or a mix of treatment performed by needle and cannula. And this is the validated 10-point photonumeric scale that was used to assess the primary endpoint of the study. And so we have grade 0, in which there are no dark circles, to 10, in which we have an extensive, severe dark discoloration. And so the results were very interesting because, as you can see, in the follow-up, in the mean photonumeric score decreased from 5.3 to 2.7. So it means that we have a very good reduction in the presence of dark circles. And it was very interesting to know that we have greater improvement in the group treated with cannula. As I told you before, from my perspective, I believe that the scratching of the cannula in the lower part of the skin could spread the product also in the dermis. And so I believe that is why the cannula give us more results in comparison with the group treated only with needle. And also the patient-reported outcomes told us that 3 months after the final injection, 87% of the subject reported an improvement in the periocular dark circle pigmentation. So I think it's very interesting because these results indicate a very high, significant patient-reported improvement in the periocular dark circle pigmentation. And I can show you some picture regarding some patient treated by other colleagues. It is a patient treated by Dr. Goktemir, in which you can see not only the improvement in the dark circle, but you can see also the improvement in the presence of fine lines and in the overall skin texture of the periocular area. So the picture on the right is in the follow-up after 3 months after the last injection. This is another patient treated by Dr. Karadag, in which you can see how, in the comparison between before and after, there is a significant decrease in the periocular dark circles, but also, as you can see, we can note how the skin texture of this patient is really improved after 3 months after the last injection. So we have also to consider the lasting of this type of treatment. So the study conclusions was that the use of Polynucleotides, so the HPT polynucleotides, could give us an immediate feeling of the tear trough hollows, so we can act on the structural effects, but we have also a clinical outcomes in the reduction of the dark circle severity. And in addition, we have also an improved skin tone and in skin texture. So we can have more results in the treatment of periocular area due to the reduction of pigmentation, in the reduction of skin laxity, and in the immediate filling of the tear trough hollows. And so the final key messages that I would like to share with you are that PN are supported by a strong clinical experience. It's more than 20 years. So we are talking about an injectable with a long history, a long experience, not only in the field of aesthetic medicine, but also in the field of healing, of plastic surgery. In addition, we have to consider that they are supported by a very wide scientific literature. And as I told you before, as they were used both for aesthetic medicine and for plastic surgery, they are indicated both for rejuvenation, but also to correct defects. So they are very helpful to treat, for example, acne scars, stretch marks, and also hair loss, for example, but is another topic. And so I believe that it's very important to consider not only the aesthetic outcomes, but also the correction of the defects of the face and or of the body. Furthermore, we have also to underline how they are supported by international guidelines that you can download from PubMed. And finally, I believe that is always on this topic. It's important not only to know and to have a very good knowledge about the mechanisms of action of this type of polynucleotide, but it's also very important to have a good technical training. This is why normally is focused on giving you the opportunity to have also not only a webinar like this, but also some training courses organized in London in which you can understand how you can use polynucleotides, how you can use this type of product and injectables in delicate area as, for example, in periocular area and or in perioral area. So this was my last update in Ramsey in London in 2025. But if you want to have more update about the use of polynucleotides, I'm honored to invite you in the next Ramsey conference that is planned on the 7th of November in London. And so if you have any request or if you would like to have any information, you can ask to Chloe and you can ask to Dennis. I will be there. So I would like to present something new about the use of polynucleotides. And I would like to thank you for your kind attention.
Thank you, Maurizio. That was excellent presentation there.
Let me mute.
Oh, can everyone hear me?
Yeah, okay.
Good. Yeah, thank you so much. That was an excellent presentation. And as Maurizio said, we've got the Ramsey Regenerative Aesthetic Medicine Conference and Exhibition on November the 7th in London. So do join us there to find out more. And just to emphasize that while Maurizio chooses to use Planest and Mastelli polynucleotides, there obviously are lots of other brands available. We're an independent organisation, so we will talk about a range of other things at the conference as well. So if anyone has got any questions now for Maurizio, please do drop them in the chat and we can get through a few before we end at 8 o'clock. I will start. We do have one here, Maurizio, on amino acids. Can polynucleotides be used alongside amino acids, and how would you factor that in? Oh, you're on mute.
From my perspective, I normally prefer to use polynucleotides alone, so I don't want to mix with amino acids or with other type of injectables. And the only, for example, I prefer or I had experience in the use of polynucleotides with PRP. I know that normally there are some questions regarding the use of polynucleotides with amino acids, with PRP, with hyaluronic acid, with other type of injectable. Um, I normally use, for example, PRP with polynucleotides for hair loss because I believe that we have to consider the different mechanisms of actions. So if we want to mix amino acid plus polynucleotides, we have an overstimulation of the fibroblast and we have an overproduction of the protein that are present in the dermis. Mixing, for example, PRP and polynucleotides, that is off-label, but I try to use in many cases, in my clinical experience, for example, in hair loss, we can combine different mechanisms of actions. So in this case, for example, I would like to use PRP as is rich of a lot of growth factors. So we have the vascular endothelial growth factor, fibroblast growth factor, and many other growth factor. And so I want to combine the action on the improved viability of the fibroblasts due to the polynucleotides and the presence of growth factors due to the presence of PRP.
Okay, thank you. Are there
And
any patients?
in
Sorry.
addition, we have also to consider that it's more deep scientific that on the surface of our fibroblast we have a lot of receptors. And we know that if we overstimulate the receptors that are present on our fibroblasts, we don't have better outcomes. So if we use the same molecules that are able to work on the same receptors or on the same mechanism of action, we don't have the same higher results.
Okay, thank you. Are there any patients who you would say are unsuitable for polynucleotides?
When they ask me this question, I normally say every patient could undergo to the treatment with polynucleotides. So from the age of 18, due to the legal problems, we can treat patients with, for example, acne scars when they are young. We can treat patients in the middle age due to the aging, or we can treat, for example, young patients for stretch marks. So we have a very wide range of patients who could undergo to this type of treatments. I normally suggest only not to treat patients who are pregnant because I don't want to treat patients also with saline solution if they are pregnant. It's only a recommendation.
Hmm. And what is your recommended protocol to maintain the impact of a treatment? Course of three, and then is it a single treatment 3 months later? Somebody asked.
So we publish in our guidelines. So if they want to know which is the maintenance treatment protocol after the first session of three different injection, we normally suggest to repeat the same treatment with three injection after 6 months. Or there is another option. Is my personal option. I normally treat my patient after 3 months with only one injection. So I would like to repeat after the first session of three injection, I want to repeat 3-4 times per year this type of treatment.
Yeah, okay, thank you. And then the eye dark circle study, can you tell us when that will be available?
I beg your pardon, Chloe?
The new study that you discussed, when will that be published? Soon, isn't it?
I hope soon, but we don't know because you know that we have to wait for the revision. We have to do the correction they asked us, but I believe that in 2, 3, 4 months it will be published. But as I told them before, is a preview.
Yeah,
So it's the first time. Maybe it's the first time that I give the preview, and
yeah,
so it's a special event today.
yeah, absolutely. And we'll, once it's published, we'll share the news of it on our website with a link to the full
Or
study so you can read it. So do follow.
or we can publish in our journal a small abstract
Yeah.
regarding
Yeah,
the study
exactly.
so they can know when it's published and they can download from PubMed.
Exactly. Thank you so much. There we are. That's all we've got time for this evening, everyone. But thank you so much for joining us. When we finish now, we'll just have a quick survey that you can input your details to make sure you're on our database so you can receive updates on all of our activities. Like I said at the beginning, in case you missed it, we've got another two webinars coming up. One on the 20th of April with Dr. Lee Walker, and that's on complications related to regenerative aesthetics. And then another one on 11th of May with Anna Baker, and that's on treatments to counteract changes from GLP-1 treatments. So both really, really interesting topics. Do sign up, it's free, and you can watch them back as well. If anyone's missed this that you want to share with colleagues, tell them to drop us an email and we can send it out to you. But thank you, Maurizio, and thank
No,
you.
thank you. I would like to suggest to join them because it's very interesting, above all for GLP-1, because
Mm,
also in the last NWC, there were two sessions regarding the GLP-1 phase. So it's a growing,
yeah, growing
uh,
trend that people
yeah,
practitioners are facing, I
yeah,
guess, isn't it? So I think it's gonna be really interesting to hear from Anna on
yeah.
regenerative treatments that can support that. So yeah, that's May the 11th, and then we've got Lee Walker on 20th of April. So
Okay.
thank you everyone, and we'll see you soon.
Thank you. Have a nice
Bye.
day. Bye bye.